Hi, I'm Molly, the student nurse. Can I have you verify your name and date of birth? Great. Okay, so I'm going to draw some blood today. The physician ordered we draw some blood to check your electrolytes because we have been giving you fluids. So before I get my equipment set up, I'm going to go ahead and take a look at the site. Now, do you have any pain or tenderness around the site? No, that's good. I'm looking here and I don't see any redness. I don't see any drainage, no swelling. Yeah, it doesn't feel warm. The dressing looks intact, so I think we're good there. All right, so I'm getting my supplies together. And our policy, I know your orders said to withdraw 5 milliliters of blood. So I'm gonna use a 10 milliliter syringe. Just gonna actually pull it out, get it ready. And we always wanna use at least 10 ml to withdraw blood from a port anyway. So I have this ready to have my 5 ml blood that is ordered. And our policy states we're going to flush and get discard before the sample, and that we're going to follow that up with 20 ml normal saline flush and no heparin. So I do have my 20 ml ready to go. And if our policy stated to change the PosiFlow, I would have that here as well. And if our policy said to use site scrubs, I would have them here as well. But for practice, we're going to use alcohol prep pads. And if I did have a continuous IV running, I would have stopped that right when I walked in the room, because you do want time for the IV to be stopped. At least 2 minutes, more time is better. So I would be getting my equipment and assessing with that stopped to give me more time. And that is because we want the integrity of the blood we don't want the blood to be diluted, because that would throw off our blood test, which could really hurt the patient. So that would be done. We don't have that running, so we're good to go here. I assessed the site. I have my equipment ready. I did prime my normal saline. I'm going to provide for privacy. Clean gloves are on. And you said no allergies. Okay. All right, so we're going to clean the site for 15 seconds using friction. Okay. Okay, so I'm going to unclamp. I'm going to push a little bit in and then withdraw for blood return, which I have. So we're ready for push pause for this normal saline flush. And how are you feeling?
Good.
Good. Okay, and then we can use the same tube for our discard sample. Our policy states at least 5 ml for discard. And then using good nursing judgment, I'm going to be looking at this blood. When I get to 5 here, I'm going to just make sure the blood integrity looks good. If it were to be very thin or light, I would withdraw some extra to make sure the blood is not diluted from whatever was running. So I'm at 5. It looks good. I pulled a little bit extra. It looks great. So I'm going to go ahead and clamp, disconnect. Now this is my discard, so I want to put that somewhere where I know that is not my actual sample. We're going to clean for 15 seconds. Okay, and now I'm ready for my blood sample. Again, our order says 5 ml. I'm using a 10 ml syringe and unclamp. And sometimes we draw a little bit extra just in case. I think I'm actually just going to draw 6 to be on the safe side. And this is my actual sample, so I'm going to put that over here so I know that is my actual sample. And then we're going to clean that for 15 seconds. 10 milliliter flush. I'm going to do a total of 20. So here's the first one, unclamp. Again, ask them how they're feeling. Looking at the site, everything looks good. Push pause technique. Okay. Remove that clamp. Clean it for 15 seconds. Ready for our last flush. Push pause technique. Oops. Unclamp. There we go. Okay, just clamp, remove, clean again. And then if we had heparin, we would use that at this time. And then alcohol again. Okay, 15 seconds are up. It is clamped. If I have a continuous IV, I'd rehook that up, but we're good here. So before I get rid of my supplies, I want to make sure my blood sample is labeled, and then it's important that we're getting this to lab right away before it coagulates or anything. So I would have my adapter, put that in the adapter, connect it to the adapter, blood tube below, get my blood sample. I would label my blood sample. There would be probably a printed label, and then I would also initial date and time the sample and make sure that gets to the lab. So I'm also going to discard my equipment and hygiene, and then document things like site, how the site looked, which was good, if there was good blood return, which there was, how much and what we used for the flush. So I used a total of 30 mils normal saline, and then how much blood was collected, which was 6 mils of blood, and the patient reacted well. And that'll be it.